Okay, final check off, take 3. See, there's nothing written on my rubric. Okay, so first I'm gonna start with Ate It, so hand sanitizer. Okay, hello Mr. Burley. My name is Meg. I'm gonna be your nurse today. I'm gonna be completing a assessment of different parts of your body, and it should take no more than 20 minutes. So if you could lean back your chair. At first I'm gonna start with an abdominal assessment. So I'm gonna start by auscultating your bowel sounds. So if you could pull up your shirt for me. Okay, that's good. I'm gonna start with the diaphragm and the stethoscope in the right lower quadrant. Moving up. Okay, moving over. Okay, so bowel sounds are active and present in all 4 quadrants. So next I'm gonna start with light palpation. So tell me if there is any tenderness or pain, okay? So I'm gonna start in the right lower, then moving up. Over. So
No tenderness or pain. We're good.
Okay, cool. So I'm gonna move to deeper palpation now. I didn't feel any lumps or no lesions are present. So deeper, starting in the right lower quadrant, moving up, moving over, moving down.
No tenderness or pain.
Okay, sounds good. And there is no lumps there either. So if you could sit up for me. Next, I'm going to be doing the thorax and lung exam. So if you can move over here. I'm gonna start by auscultating your thorax. So each time I place the stethoscope, I want you to take a deep breath for me, okay? So I'm gonna start by assessing your bronchial sounds. Okay, moving to bronchovesicular. Okay, vesicular sounds here. Okay, could you lift up your arms for me? Listening for vesicular sounds here as well. Deep breath. Okay, so moving to your posterior side, I'm gonna listen bronchovesicular here. Deep breaths for me. Okay, and vesicular. Okay, so no adventitious lung noises are present, no sign of any crackles or wheezing or rails. So next I'm gonna move over to the cardiovascular exam. So I'm gonna start by palpating some different pulses. So I'm gonna start with your dorsalis pedis pulse. Okay, so that is 2+ and present. Moving to your posterior tibial, 2+ and present. Moving up to your brachial, 2+ and present. Moving into your carotid, 3+ and present. 3+ and present. Okay, so next I'm going to move to, so I would assess his popliteal pulse. And although I can't feel anything, I would use a Doppler just to make sure there's a pulse present there. Next, I would palpate his femoral pulse, which is located in his groin area. So, next I'm gonna move over and assess for peripheral edema in the arms. So there's no pitting present in the arms and no pitting present in the legs. Okay, so next I'm going to listen to his heart with the diaphragm of my stethoscope first. So we're going to start with aortic, pulmonic, herbs, bicuspid, mitral. Okay, so S1 and S2 are present in all 5 areas. So next I'm gonna turn it over to the bell of my stethoscope and listen for any murmurs. Okay, aortic, pulmonic, herbs, tricuspid, and mitral. Okay, so no signs of any murmurs or irregularities there. So next I'm going to do the eye exam. So I'm going to take my pen light and when looking at Clay, look at me, I see that his pupils are both round and they're bilaterally even sized. There's no uneven borders. So next I'm going to be assessing for his eyes reactivity. So I'm going to start on his left side, going out. Okay, so I see that his pupils are reactive on that side. Next, they're contract on that side as well. So Clay, look for me. Focus and out. Okay, so they're also accommodating as well. So next, I'm going to palpate Clay's lymph nodes and make sure there's no swelling present there. So first I'm going to start with pre-auricular. Now I'm going to move to post-auricular. Now I'm going to move to, don't move your head. I'm going to move to tonsillar right here. Then to submandibular. Then submental. Then occipital. I'm going to move to anterior cervical on the anterior side of the sternocleidomastoid muscle. I'm going to move to posterior on the posterior side of the muscle. Now, could you look this way for me? I'm going to move to deep cervical on top of that muscle. Okay, next I'm going to move to suprascapular right here and subscapular right here. Okay, so no swelling of the lymph nodes is noted. Next, I'm going to conduct a musculoskeletal exam. So Clay, if you could stand up for me. Okay, so first we're going to start by testing your hip joint. So could you complete an abduction exercise for me? So move your leg out. Okay, other side, like this. Okay, next we're going to test your shoulder. So start putting your arm forward to do an external rotation. Okay, on that side, and I'll do the other. Okay, so shoulder and hip joint are both working well. So next, we're going to assess all 12 cranial nerves. So if you could sit back down for me, could you close your eyes and close one nostril? Okay, so first, close your eyes. No, don't do that. Just close it. Okay, could you tell me what that is?
Coffee.
Yes. Okay, so move to your other nostril. Can you tell me what this is?
Looks like perfume.
Yes. Okay, so olfactory nerve checks out. Next, we're going to do optic. If you could open your eyes for me, cover one up. Okay, tell me how many fingers am I holding up?
3.
Okay, now other side. Okay, how many fingers am I holding up?
4.
Yep. Okay, That one checks out. Next, we're gonna move to oculomotor. So we're gonna test the reactivity of his pupils again. So on the right side, pupils are reactive. On the left side, they are reactive. And on this chart here, they're a size 3, which is a normal finding. So next, we're gonna move to the trochlear nerve. So Clay, could you look at my finger, please, and follow it down? Okay, trochlear nerve checks out. Next is trigeminal. So could you clench your jaw and close your eyes for me? Okay, so this is dull and this is soft. Tell me which one you feel when I touch your face, okay?
Dull.
Okay.
Soft. Dull.
Okay, so that one checks out. Next, we're going to go to your abducens nerve. So could you follow the pattern of my finger? Okay, so all 6 fields of vision check out. So next, we're going to go to the facial nerve. So could you give me a smile? Okay, could you wrinkle your forehead? Okay. So next, we're going to do vestibulocochlear. So could you stand up for me? And close your eyes and hold your arms out. Okay, so we can see that his balance is intact. Now, Clay, when I whisper a word behind you, tell me what you hear, all right?
Piano.
Yep. Okay, so vestibulocochlear checks out. So next, we're going to move to the glossopharyngeal. So could you open your mouth and give me a nice ah?
Ah.
Okay, so uvula is midline and intact. Next, we're gonna check his vagus nerve. So Clay, could you swallow some water for me? Clay. Alright, so believe it or not, he could swallow. And so that one checks out. Next, we're going to do your
I have corona now.
what's the next one? Oh, your accessory. So could you give me a nice shoulder shrug? Okay, cool. And next we're gonna do your hypoglossal. So just stick out your tongue and wiggle it around like Okay, so cool. So all 12 cranial nerves check out. Next we're gonna move to your reflexes. So first we're gonna check your patellar. So
one?
yeah. So okay, so his patellar checks out. Next, we're gonna move to brachioradialis. So relax your arm for me. Okay, cool. Next, we're gonna move to tricep. So relax your arm. Okay, so that checks out. So that completes the final assessment.